So the main message that came out of this recent MDA scientific conference on limb-girdle muscular dystrophy is the advancing research into identifying the biomarkers and also treatment for limb-girdle muscular dystrophies. As we all know, as of right now, we do not have any treatments that's available for any of the limb-girdle muscular dystrophies. And it was very encouraging and interesting to see all the basic science research that went into and that is also ongoing to find biomarkers for this disease and also gene therapies and other therapeutic interventions for limb-girdle muscular dystrophies. As far as the specific biomarkers that we're talking about is the measuring the activity of the actual proteins that is deficient in these limb-girdle muscular dystrophies, such as there are muscular dystrophies associated with deficiency or decreased activity of beta-sarcoglycan, dystroglycan. So if we are able to measure these activity of these enzymes, so that would be critical for us to monitor the disease progress as well as the treatment response. So in terms of O-glycosylation of alpha-dystroglycan, there was some information presented at the MDA meeting. Authors proposed a novel Western blot method to measure the O-glycosylation of alpha-dystroglycan in patients with limb-girdle muscular dystrophies. I think this information may be helpful in the future when we have new therapeutics available for these limb-girdle muscular dystrophies to assess the disease progression as well as the effect of the therapy. So the potential future implications on the information that we learned from biomarkers is how we can monitor the disease activity and also the response to if there are any future treatments available for these patients with limb-girdle muscular dystrophies. It is critical that we have biomarkers to maintain or to monitor the disease progression and also the effect of the treatments in this population. Yes, we are interested in the clinical measurements like the functional measures that we do when we see them in the clinic. In addition to that, it would be convincing to see any improvements in these biomarkers that we can use to assess the improvement or the response to the treatments. And these biomarkers could be something that we check using blood or something we could check in the muscle biopsies. But I think it is critical to have such biomarkers for these rare diseases to assess the disease progression as well as the treatment response.